I'm Dr. Keema Clark, and I'm a personal professional development coach, Wake Forest University School of Medicine. And the job that we do as a PPD coach is multifaceted. A lot of what we do is work with face focusing with first year medical students and we're with them for the longitudinal direction of their medical school program. The difference in myself being a personal development coach and we'll say one who is a full-time faculty member in a specific subject. We're with these students day in and day out, not just doing that course. And the other uniqueness of it is we get a chance to ask them questions and we tap into their personal experiences. If you're just in my course, I see you coming and you're taking a test or an assessment and you move on to the next longitudinal course. We're with them from the beginning of this experience to the end, and we get the chance to see them grow from being, this person's coming and says, I want to be a neurosurgeon, to a person that says, you know what, I actually want to do family med. There are different levels of character that you may have to improve upon, or there are different character traits that you may have that you may need to engulf in a little more to be, I think, the best physician you can be. And so what we have done in the Center for Personal Professional Development, we do a lot of programs that allow students to hear from high pressure character experiences, but also have you to evaluate where you are with that. For example, one of the things we talk about is respect for diversity. And it can go a long way. I'm using respect for diversity because I think one of the things that we have to be mindful of when you walk into a patient's room as you are practicing, as well as when you are kind of within the actual live space for the patient, your experience is totally different from that patient's experience. Your community is totally different from that patient's community. Your lived experience is different, as well as what they're dealing with may be different. So I use respect for diversity as a way you can now stack your character on top of that. Am I compassionate enough in that moment? Am I having respect for diversity in that moment? Am I understanding things like social determinants of health in this moment? Because they could look like you and I, but have a totally different lived experience. And so when we put these programmatic opportunities together, we put these programs together so that students can come in and hear from real people who've had real positive and or negative experiences with medicine, and it's a way for you to evaluate your character to say, how would I work in that moment? And we come back and we have individual meetings with students about some of the programs.